interested in being an egg donor, which is great, and this is just kind of an orientation about how the process works and what to expect if you're a donor through our organization. So essentially we are Oregon Reproductive Medicine, which is the facility that where we do all of our ultrasounds and egg retrievals and all of our cycles, and the Exceptional Donors is kind of the donor division within Oregon Reproductive Medicine. So this just kind of gives you an idea about the organization. You've probably talked with Katie Shaw. She's our donor recruiter. She probably kind of got you all here in the first place. And then Corby, I know you've been talking a lot with. She's our matching coordinator. We also have, once you get further down the line and you're actually chosen to donate, we have donor coordinators who will kind of help you through your cycle and be letting you know what you're supposed to be doing, when you're supposed to be doing it, and all that good stuff. They'll be getting you calendars and telling you how to use your medications. So they'll become more of your contact as we move through the process. We've also listed up here our recipient coordinators, who are mainly in charge of the recipients of the eggs, but they also kind of work together with the donor coordinators to make the cycle work. And then we have our administrative coordinators, who are also kind of behind the scenes, help out with a lot of the paperwork and phones and messages, and you'll be hearing from them a lot as well. So that just gives you an idea of who everybody is. Go ahead. We have 4 physicians that oversee all of our cycles, and they're listed up there. You will not have a lot of contact with the physicians for the most part. When you come in for ultrasounds and evaluations, you'll be seeing one of the nurse practitioners, myself, or Alexa is another nurse practitioner, Andrea is another nurse practitioner. The doctors kind of oversee the cycles, and they're also the ones that do the egg retrievals. So once the eggs are ready, they'll be removing them. And I'll talk a little bit about that procedure a little bit later. Another thing to let you know of is we have 2 offices. Our main office, which is where you all have gone for your ultrasounds on Lovejoy. And then we have our West Side office. And our West Side office is located over by St. Vincent's. And Dr. Hesla primarily works out of that office. So if you were matched with a recipient of Dr. Hesla's, then you may be going out there for some of your ultrasounds. We aren't sure when that's all going to be initiated, but it'll be sometime in the next year. The other 3 physicians work primarily through our Lovejoy office. So there's a list of our nurse practitioners. I'm Shannon, by the way. I think I've met all of you already. So, okay. And Alexa works at the West Side office, so you'll be seeing her a lot if you go out there. So this is just kind of gives you an idea about why people need donor eggs. There's a variety of reasons. Everybody's a little different in how they come to need an egg donor. These are just some of the more common things that we have found. And they're listed here. So, you know, as women get older, our egg quality declines and our egg quantity declines, and our ability to get pregnant becomes a little bit more difficult. So sometimes that's a reason. Some women have early onset of menopause, so that can occur even as early as in their 20s. And women who may think that they're perfectly fertile in their 20s or 30s may find that they need to use an egg donor. Some women are born without ovaries, or perhaps their ovaries or other reproductive organs may have been damaged from disease, or they might have had them surgically removed for a variety of reasons. Some are carriers of genetic diseases that they don't want to pass on to a child. Other people have had cancer or chemotherapy that have caused infertility. We also have a large population of same-sex couples who are in need of egg donors, so lots of different reasons. So this just kind of tells you who is eligible. Pretty much all of you are eligible since you're here, but we have some age criteria, and that's just because of egg quality issues. We want you to be height and weight proportionate, and have good physical health, college attendance or career, Regular menstrual cycles is good. No recent Depo-Provera use, which is a form of birth control. It's the Depo shot, some of you may have heard of. It can kind of throw off your cycles and keep you from having regular cycles, which is why we prefer you don't have any recent use. But if you've used it before and it's been months or more, then that's okay. No smoking, no drug use, mature and responsible, and just available and committed to the process. Because one thing about egg donation is it's more of a process. It's not just you walk in and you give your eggs. We have to grow them, which is a little bit more involved than, say, a sperm donor, but we've tried to streamline it, and we'll go through the process here in a little bit. Okay. So we've just kind of listed out some different things to think about that you might not have thought about before. For the most part, all of our cycles are anonymous, which means that you don't know the recipient doesn't know you, other than, you know, you're identified by a number, and they've had access to your profiles online, but that's about it. Some recipients and some donors want that contact to be an option, whether now or in the future. And that's something that is something that if you were interested in, or if they were interested in, that we would be kind of communicating and letting you guys know. Certainly if you were matched with a recipient who wanted to meet you and you said, no, I'd rather remain anonymous, we would absolutely respect that, but you may be approached with that as an option. The embryos that are created, so when you donate your eggs, they're fertilized and they become an embryo. An embryo is basically a fertilized egg. So once those embryos are created, they are, it's up to the recipients of those eggs to decide what they want to do. Most recipients use all the embryos, and they, may use some with that cycle. They may freeze some for a later pregnancy later on. But some recipients have a large number of embryos that they may find that they don't need to use. They've completed their family, they have 5 embryos in the freezer, that those could potentially be donated to another couple if that was their choice. The eggs may be used by a same-sex couple or a single parent. Lots of different ways of building a family. You may be asked to participate in our frozen egg bank program. So this is kind of something that's we're working towards doing a little bit more frequently. So traditionally, when people donate their eggs, they go to one person and they're matched, and that's how the cycle is put together. But some people make a lot of eggs. So one person has usually doesn't have much use for 50 eggs. So if you were to produce 50 eggs, then you might be asked to donate those eggs to be used with multiple recipients. So those could potentially be split up amongst, a couple, 2, 3 different recipients. We're doing that, periodically. It's not something we're regularly doing. So if that was something that was intended for your eggs, you would be aware of that and make sure that you were okay with that, but just some things to think about. Also, like I said before, all of the donation cycles are anonymous, and we are very, very careful to respect and maintain that anonymity, but I can't guarantee that 50 years down the line there might be genetic tests available on the internet or something that people would, the recipients could potentially find you, but again, that I know of, so it's something to think about there. So what happens after completing your application? So a lot of you, if not all of you, are kind of past this stage, but basically your application will be reviewed by a physician or has been reviewed. You, I think, all have had ultrasounds and blood work just to kind of evaluate, make sure everything looks normal. And then once that piece is approved, then that's when your profile is posted on the website for recipients to look at and potentially choose you as their donor. Everybody's different in what they're looking for in a donor. This is just a list of some things that we find recipients are looking for. They will sometimes look for people with similar ethnic background, or similar health history, similar physical characteristics, fertility history. Some people want different hobbies or interests or personalities stand out, and that's kind of what they're looking for. Some recipients are very focused on education level or different musical talents. There's all different things that the recipients are looking for. Once somebody is interested in your profile, you'll be contacted by Corby, and she'll be letting you know that somebody is looking at using you as a donor, and it's varied according to how long it might take to be selected. Some people are selected right away, as soon as they go up on the website. Other people, it might take several months. So it's variable, but certainly if you have been waiting and not been contacted and it's been several months, you're more than welcome to call Corby and just kind of touch base with her. Certainly if there's ever any updates to your profile or updated photos or anything that you can think of, you can always access that and update that, and sometimes that helps too. Once you're selected, you'll be contacted and kind of talk about your availability. We'll always want to know when your last period is, so it's a good idea to keep track of your periods while you're waiting to be selected, and we'll want to know if you're on any form of birth control. We would bring you in for additional screening tests. Those might include a physical exam, urine drug screen, communicable disease blood tests, genetic testing. You'll have a visit with our psychologist. I think some of you have already done that. But if you haven't, you'll be asked to complete a brief psychological test, and we'll give you some consent forms and a legal contract, and then we'll have you take a short course of antibiotics, and that's just to kind of make sure that there's no infections in your system that you might not even know about that we could take care of before the donation. And if you're already on birth control pills or hormonal birth control method, coordinating the cycle might go a little bit quicker. So it's great if you are, don't stop. Because if you're not on them, we will eventually put you on birth control pills, because that's what helps us to coordinate your cycle with the recipient's cycle. We can sometimes do funny things with birth control pills in order to coordinate, because basically we need you to be synchronized with the recipient so that when your eggs are ready, her uterus is ready to receive those eggs. So sometimes we'll play around with birth control pills. We might have you take less than a full pack of pills or more than a full pack of pills. We might have you take, less than a week off in between active pills. So we'll give you, if we do something like that, we'll give you detailed instructions on that. We will start to make a calendar for you, so you'll know exactly when you're going to be needing to come in for appointments and when the egg retrieval is likely to occur. We'll also have you do an injection training where we go over some of the medications that we use. Since they are injectables, we teach you how to inject those yourself. And we do usually small group injection trainings with a couple people. Sometimes we'll do one-on-one, just kind of depends on timing of everything. The donation will take place largely at our clinic down on Lovejoy, Oregon Reproductive Medicine. We don't send you to other clinics or anything like that. But like I said before, patients of Dr. Hessela's might be asked to go up to the West Side office for ultrasounds. The egg retrieval, where we take out the eggs, though, is done at our Lovejoy office, where you've all been. So we're going to ask some things of you while you're going through this cycle. This is a list of some of those things. We're going to ask that you not smoke or drink alcohol or any illegal drugs. Don't take any medications unless you've run them by us and we're aware of them. We also ask that you not eat a lot of poppy seeds and avoid prescription pain pills, or let us know if you're on prescription pain pills. And the reason for those two things is because those can come up in a urine drug screen. So we would prefer that you not travel for extended time out of the country, again, more like availability issues. Tattoos, piercings, or acupuncture within 12 months must have a letter stating that sterile needles were used. So if you've had any of those things done, you'll just want to let us know which office you've gone to, and we can get a letter from them. We will be giving you some exercise restrictions during the cycle, and that's mostly because as the eggs grow, your ovaries will grow, and we don't want you doing any kind of bouncy or high impact exercises because that can jostle your ovaries, and we don't want that to happen. So we'll tell you for about 3 to 4 weeks, we'll recommend low impact exercise. Walking, biking, swimming, those sorts of things are fine, but just nothing really high impact. We want you to just stay healthy, eat a healthy diet. We will be giving you vitamins to take during your cycle. It's a prenatal vitamin, so that'll be good. We ask that you not partake in any risky sexual behaviors. Again, we don't want you at risk of any sexually transmitted infections. And while you're waiting to be selected, we just ask that you keep us updated with any changes to your address or phone number, any other contact information, so that we can contact you once you're selected. Also, if any new health issues come up, either with you or your family, if you could let us know, that would be great. Just because that could be valuable information that we'd want to pass on to the recipient if there was any sort of genetic link potentially to any health issues. Keep track of your monthly cycles, and then once you're chosen, we just ask that you be able to commit. The recipients often have been through a lot to get to the point of using an egg donor, and they are very emotionally invested in it, and it can be really devastating if you're unable to follow through once you have committed to the process. We will be having you come in for appointments, which I'll go over in a minute, but we just ask that you be punctual for those appointments. They're usually pretty brief, 15 to 30 minutes, and if you're late, then that can throw off some other appointments for your provider. We'll be giving you a calendar that details all the medications you're going to be on, when you're on them. We just ask that you follow it exactly as it states, and be proactive. If there's ever any questions or concerns, if you aren't sure if you did something right or if you did something wrong, we'd rather have you tell us so that we could potentially fix it or make up for it. We always have an on-call provider after hours, so a lot of your injections will be given after hours. So if something comes up and it's 8, 9, 10 o'clock at night and it's important, we'd rather have you call us than not. We also ask that you have at least your first name on your voicemail or answering machine. When you're coming in for appointments and monitoring during the cycle, we'll be calling you pretty regularly with updated instructions. And if you're not available, we can certainly leave that on a voicemail. We just want to make sure we're leaving it on the right one. So that would be great if you could make sure that that's on there. And then we will also be giving you some abstinence requirements during the cycle. And that is just because, for a couple of reasons. Number one, we don't want you being exposed potentially to any sexually transmitted infections. And number two, we don't want to risk you becoming pregnant during the cycle. I kind of talked to you a little bit already about the birth control pills that we have you on. We also use a medication called Lupron, another medication alternatively called Ganirelix, and both those medications, you'd either take one or the other. That helps to prevent ovulation until we're actually ready for the eggs to be released. We will give you have you take what's called gonadotropin injections. Gonadotropins are the same hormones your body makes to grow eggs. In your case, if you're ovulating, you're just growing one egg a month. We want you to grow multiple eggs, though, and so we give you a little higher doses of these hormones than what your body's normally used to making. And if you take them for about 10 days or so, these gonadotropin injections, and during that time, we'll be seeing you periodically for ultrasound and blood tests to watch the eggs grow, make sure that the dose that we have you on of the medicine is appropriate. We can raise or lower the dose as needed, so that's why we kind of keep a close eye on you. Those are very brief appointments, 15 minutes in and out. We try to do them first thing in the morning, generally between 7 and 8 a.m. so that you can get off to work or school and not have your day too disrupted. Sometimes those appointment times aren't available and we might need to see you later, so we just ask that you try to be as flexible as possible during this time. Once the majority of the eggs reach a mature size, which we can tell by ultrasound, we have you take what's called a trigger shot. It's a hormone called HCG, and it's a one-time shot. It's actually your last shot of the cycle, and it causes the eggs to start the process of being released and matured. We give you a very precise time to take that shot, because if the timing is not quite right, you might ovulate and release those eggs before we're able to take them out. So it's always going to be given 35 hours before the egg retrieval. We will tell you exactly when, so you don't have to guess about that. But you will always know 2 days in advance of when your retrieval is going to be. We can give you an estimated retrieval time, usually within a few days, but sometimes it boils down to, are the eggs ready today, or are the eggs going to be ready tomorrow? And so we'll try to give you as much advance notice to that as possible for the day of the egg retrieval, but like I said, you'll know for sure 2 days in advance. So this is a list of the medications that I kind of already covered. I'll go over some of these more in a minute. Let's see. Doxycycline is the antibiotic that you take before the cycle. We'll give you that at some point to take for about 10 days. And then we will also have you take that after the egg retrieval, just to minimize risk of infection from the egg retrieval. That's a tablet. Dexamethasone is another tablet that you'll be taking. And that is a medication that just helps to improve egg quality. And you just take that once a day. Sometimes people complain of some difficulty sleeping with the dexamethasone, so if you notice that, we would just instruct you to take it earlier in the day. Aspirin, we have everybody on a baby aspirin because that helps with blood flow, so that when you're taking these medications, they're being absorbed well and getting to the ovaries well. And then the prenatal vitamin, those are all pills that we'd have you take. I'll talk a little bit about the injections next. Birth control pills. And the birth control pills, let's kind of go back to that. So like I said before, sometimes we vary the number of days that you'd be on birth control pills, and it helps at the beginning of the cycle to synchronize you and the recipient, but it also has the effect of suppressing your ovaries and keeping you from ovulating. It also keeps all those little follicles, those egg sacs, small, and keeps the eggs from growing until we want them to grow. For those of you who haven't taken birth control pills before, most people do great on them. Some people have side effects such as spotting or some headaches. Let us know if you have any severe headaches, but most people just complain of spotting. That's about it. If you take it at about the same time every day, that'll help to reduce the risk of that. Okay, so now we'll talk about the injections. So Lupron is one injection that you may be on. This is given, all the injections actually are given in the subcutaneous or the fatty tissue in the lower abdomen with a really tiny needle. Doesn't go in very far at all. It's the same type of needle that diabetics use for their insulin injections. So we'll teach you how to use these. But Lupron works to suppress the ovaries and keep you from ovulating, keeps the follicles small. We don't use this as much anymore, so most of you wouldn't be on this, but occasionally the doctors will want to use this for a cycle. And if you were on this, some possible side effects could be some headaches or moodiness or hot flashes because it temporarily lowers your estrogen levels. Tylenol is okay to take really at any point during the cycle, but let us know if you have any severe headaches. For the most part, we're using Ganirelix, which is an injection that you take towards the end of your stimulation for the last few days right before the egg retrieval, because what it does is it just helps to prevent ovulation. It comes in a pre-filled syringe, and once you start it, you take one injection every day. And again, it's given in the fatty tissue in the stomach. And we would tell you when to add this in. You would come in for ultrasound, and we would see how big your follicles are and let you know if you're ready to take it or not. It's usually a noontime injection, and once you start it, you take it every day until through the day of the trigger shot or the HCG. Side effects of this one, pretty minimal. I haven't really heard of side effects, but you might have a little irritation at the injection site. That's about it. The other injections that we have you take are Menopur and either Follistim or Gonalep. Your Menopur is a morning injection, and then the Follistim or Gonalep is the evening injection. And these are the medicines that you take for approximately 10 days. And this is what's going to grow those eggs. We'd say to give them approximately 12 hours apart. Doesn't have to be exact, but we just tell you to pick a time of day in the morning, pick a time of day in the evening, and try to be somewhat consistent, approximately 12 hours apart. Side effects from these medications, these are the same hormones your body makes, just more of them. So I don't expect you to have side effects other than maybe some irritation at the injection site. As the eggs grow in response to these medications, your ovaries are going to get bigger. So it's going to be normal to feel more bloated and just kind of crampy and uncomfortable. You shouldn't be in pain or anything like that. You should be able to go about pretty much your normal activities, just with the kind of moderate exercise restrictions. But you will probably feel a little bit more full and bloated. This is an example of the calendar that you'll be getting when you are selected to donate. And it looks a little confusing, but basically it'll tell you at the very top when to start your birth control pills, and then it'll tell you when your last birth control pill is. So for example, here on April 10th it says last birth control pill. You'll see there's other tablets written in there, the dexamethasone, prenatal vitamin, aspirin. So you just remember to take those every day. There's boxes next to each of the medications, and those are designed to be check boxes for you so that you remember you've taken it. So I recommend that you use those boxes, because once you start on these medicines, one day can seem like the next day, and you might forget, gosh, did I take my birth control pill? Did I not take it? I don't remember. So just check those off every time you take a pill or an injection. Down where it says day 1, there on 4/15 on Sunday, that's what we consider day 1 of stimulation. So that's when the medicines to grow your eggs are going to start. You'll see it says Menopur and Follistim, and then you'll see it says the dexamethasone, prenatal, and aspirin pills that you'll continue to take. Typically, you'll take these injections for about 2 to 3 days before you come in for your first ultrasound. So if you see in the highlighted area there on 4/17, that is usually when your first ultrasound would be, to evaluate your response. And then after that, we would tell you what your dose would be of the Menopur, and in this case, Follistim. If we need to make any adjustments, we will let you know what the doses would be until we see you back again. Usually we see you about every other day. So you'll see there on day 5, it says ultrasound and blood. And then after that, it'll kind of say possible ultrasound and blood, because it really depends on how your eggs are growing. If we need to continue to see you in that every other day pattern, or if we maybe need to see you a little bit more frequently. So you'll always be informed after your ultrasound is done and after your blood work comes back on when to come back again. So on this particular calendar, you'll see where on the last row there, possible day of egg retrieval on day 12. So that's assuming that this person's eggs have taken 10 days to grow. So the day 10 would be the last ultrasound and blood. You would take your HCG and trigger shot, and you'd come in 2 days later for the egg retrieval. The day in between the trigger shot and the egg retrieval, you are just coming in for blood work only. That's about it. So that's an example of the calendar there. I also have a slide of the Lupron calendar. Again, we're not using this one quite as much. The only difference between this one and the other one before, I missed the Ganirelix, we'll go back. So the Ganirelix, you'll see it says midday Ganirelix, start if instructed on day 5 there. So that's potentially when you would start that injection to keep you from ovulating, and you take that every day until we tell you to stop. Okay. So the difference is that the Lupron, you don't do ganirelix, you just take Lupron every day, and it starts a little bit earlier up at the top while you're still on birth control pills, and then it continues throughout until you take your trigger shot. So that's the difference in the two protocols. Everything else is the same. You still take the same medications. You still come in for the ultrasounds and evaluation of the follicle growth, in the same kind of pattern as you did the ganirelix calendar. Okay. Okay, so on day 3 of stimulation, so that's after you've taken the injections for 3 days, that's when we tell you to really try to minimize your activities. You want to avoid avoid high impact exercises, no jumping. We're trying to maximize the blood flow getting to your ovaries, so we don't want you having your heart rate above 140 or overheating your body, no hot tubs or jacuzzis. As the ovaries grow, you're going to feel them get a little bit bigger with the bloating, so we don't want you doing anything that could potentially twist those ovaries. It's a condition called torsion. It's extremely rare. If it were to happen, you would know it because it'd be very painful. But it's basically the ovary is connected with a very thin ligament and a blood vessel, basically. And as the ovary grows, if you're doing a lot of jumping, it could be kind of moving around and potentially twist that that blood supply off. So we don't want that to happen. The ovaries, after the eggs are taken out of the ovary, after they're retrieved, those egg sacs that they grew in, the follicles, continue to be enlarged with fluid. It usually takes a couple weeks for them to shrink back down to normal levels. So right after the retrieval, you're still going to feel bloated, but over the next week or two after, you'll start to feel that go down and get back to normal. So this is just kind of an example of how your ovaries look normally. So you'll see there's a cross-section of one on the far right there. That's showing you what the inside of the ovary looks like. Those little blue spots are designed to represent follicles, which are those little egg sacs that we've seen on ultrasound with all of you. And these are resting size, so they're small. We can see them on ultrasound. Can't see the eggs, they're too small, but we can see them. And then you can see the little ligament there that's suspending that ovary, and the uterus right in the middle there. So once the eggs grow, they could potentially look like this, which is kind of an exaggeration. Not everybody's ovaries are going to look this big, but some certainly will. So you see all those little follicles that were small have now grown. And this is a pretty typical response of somebody who has a good number of eggs. And you can see that they've gotten bigger and they've kind of sunk down a little bit. And you can actually see that they're very close to the vaginal wall down there. And that's important because that's how we actually retrieve the eggs, is we go through the vaginal wall. Right here, the vaginal ultrasound is placed with a little needle attached to it, and the needle is passed through, which is just a membrane of skin there, and it goes into the ovary. Once the needle is in the ovary, it is maneuvered into the follicles, and the follicles are drained out with the eggs coming along with it. We collect it in a test tube, and that's how we collect the eggs. Once we've done one side, we go to the other side and do the same thing. It's pretty brief, pretty quick. It takes about 15 minutes or so, maybe 20, and I'll go over a little bit more how the retrieval works. But we completely bypass the uterus, we bypass the fallopian tubes, and it's a very safe and easy procedure. Once the lead follicles are ready, so once your ovaries look like that picture back there, we're going to have you take the HCG. We call it the trigger shot. And sometimes we do what's called a Lupron and HCG trigger shot, which is 2 injections, do them at the same time, but we would talk to you about that if that were the case with you. It's given 35 hours before retrieval. We'll give you the time. And I already told you about the 2-day advance notice. So for example, if you were going to take a trigger shot on Tuesday night, your retrieval would be Thursday morning. On the day that you're instructed to take the trigger, you'll be given a detailed checklist. We'll tell you it's going to be the last time you take all these injections, and then we're going to have you come in the next day for some blood work. So that day, in between the trigger and the retrieval, you don't take any injections. We just ask that you eat and drink well that day. We're not going to want you to eat or drink anything after midnight. And then we'll do the blood test that day. And then the next day in the morning, we'll have you check in about 45 minutes before the procedure. It's done at our Lovejoy office, and you are under a light anesthesia during the retrieval. It's the same type of anesthesia that is used for minor procedures like wisdom teeth removal, kind of in-office procedures. It's given through an IV in the arm, and it's a combination of pain relief and sedation so that you're asleep so you don't feel the needle. It's not considered general anesthesia, though. You are breathing on your own. You have your gag reflex and all that. We have an anesthesiologist on staff to help you to administer it for you and keep an eye on you. But it's very short acting. You're asleep for like a half hour or less. After it's done, you wake right up, and we keep you in our office for about an hour afterwards just to make sure you're doing okay. And then after that, you can go home. I kind of already told you how the eggs are retrieved. I think I have a picture on the next page here. Yep. So this is like a side view, kind of. So you see the ultrasound probe there, and then there's the needle attached to it. So the needle goes into the ovary, and then there's some gentle suction that's applied, which draws out the egg and the fluid into this tubing, and it's all collected in a test tube. So once we fill up the test tube with an egg or two, we pass that off to our embryologists who have it in their lab. They keep it in their incubators, and then we put on a new tube and just kind of keep going through the ovary. That's actually an ultrasound picture of what the doctors are seeing when they're doing the egg retrieval. So I'll show you. This is a follicle right here, this black area, and then you can see the needle right here. So once the follicle is drained of fluid, it shrinks down so the doctors can see that they've drained out that sac, and then they just go into another sac. So on the day of the egg retrieval, we just tell you to plan to be in the clinic for about 2.5 to 3 hours, just because we have you come in early, and then there's the egg retrieval, and then we have you stay for an hour after. You can bring somebody with you to wait with you. We have procedure areas that they can hang out in, or they can pick you up, whatever you prefer. You will need somebody to drive you home, because you won't be released by yourself because of the after effects of anesthesia. It's great if you have someone with you. Most people feel totally fine afterwards, but you might feel a little dizzy or nauseous or something like that, so it's nice to have somebody with you. So no driving school or work on that day. We ask that you not bring children into the procedure area. And then most women are able to return to their normal activities by the next day. You might still feel a little bloated, like I said, but you can go about your normal activities, and we're more than happy to provide a note if you need that for your work or school or something. We'll give you the antibiotic doxycycline after the retrieval. If you live out of the greater Portland area and you're planning on going home, we will have you come in for what we call a post-operative appointment the next day, the day after the retrieval. We just want to make sure you're recovering okay before we send you off to home. And we're going to ask that you continue to abstain from intercourse until your period starts, which will occur approximately 2 weeks after the egg retrieval. And that's because we don't want to risk infection or pregnancy. Your ovaries will still remain a little enlarged, but should start shrinking back down during that time. Call us. Certainly we want you to call us if you have any severe bloating that seems out of the ordinary, pain, anything like that. It's normal to have a little bit of bleeding after the retrieval, but we wouldn't expect a lot of bleeding, so you're going to want to let us know about that. And you're going to want to let us know when your period starts, or if you don't get a period within 3 weeks. So overall, it's a very safe process. There's risks that I just want you to be aware of. They're extremely rare risks, but those things would be like infection, and that's just from the needle potentially causing infection at the retrieval. That's why we give you antibiotics afterwards, just to minimize the risk, and the doctors are very careful to make sure that they're not introducing any bacteria. Bleeding, like I said, you might experience a little bit of bleeding after the retrieval because of the needle stick through the vaginal wall. But there's always a small risk that the needle could cause bleeding in the ovary or in a blood vessel in the pelvis, and in which case, you'd be uncomfortable, it'd be pretty painful, and we'd be able to most likely know if you were bleeding before you even left the office after retrieval. That's rare. Hyperstimulation syndrome, also known as OHSS, is one of the other risks that happens rarely. Less than 1% of all donor cycles have hyperstimulation. But what that is it's where you kind of get too good of a response to the medications. You get a lot of eggs to grow, and your ovaries get really big. You can get really uncomfortable, and you can get fluid that builds up around the ovaries. This fluid, because you get kind of leaky vessels, and the fluid that should be in your circulation is now being deposited around your ovaries, and you're getting more bloated. In severe cases, that fluid might need to be drained off through the same type of procedure that we used for the egg retrieval, and you might need IV fluids given to just get that fluid back in your circulation. Eventually, it corrects itself, and you stop getting fluid around the ovaries. But during the time that were happening, we would just keep a close eye on you. And you can feel kind of crummy, kind of nauseous and vomiting and shortness of breath. You would know if you were having this. But like I said, it's pretty rare. The medication protocols that we're using now are limiting the risk of this, so we're seeing this much less and less as we're changing our medication protocols. If you have any complications at all from the process, we have an insurance policy taken out on you, so that would cover any medical issues related to the donation, and that's good for up to 90 days after the retrieval. If you do have your own insurance, I think the way it works is they ask that you use your own health insurance first, and then anything that's not picked up by that would be picked up by the insurance that we take out on you. Just some additional information. We'll give you your compensation check on the day of the retrieval, and there's the scale there for you. And you can donate multiple times. ASRM, which is the organization that oversees reproductive medicine, they recommend 6 times, up to 6 times you can donate. Donating your eggs does not affect your future fertility. We are basically using those eggs that would normally just die off in a month anyways. We're just trying to get them to grow and capture those. And you're born with hundreds of thousands of eggs, and you'll only use a very small fraction of them in your lifetime. Egg donation is considered tissue donation at the state and federal levels. It's actually, all of our procedures are overseen by the FDA. We have to submit to different rules and regulations that they state. So that's the reason why we have you come in for a lot of infectious disease blood tests and physical exams and those sorts of things, because that's their regulations. You're not responsible for any costs that may come up during the process, just so you know that. And most of our donors donate multiple times, so we hope that you have a good experience. And the nice thing about donating with us is that we don't send you out to lots of different clinics. Everything's done with our doctors, with our nurses, and with our coordinators. So, we hope you have a really good experience and come back and donate some more. We thank you very much. So that's kind of it in a nutshell. Any questions, clarification that I can expand upon? Kind of made sense for the most part? Good. Well, like I said, you'll be coming back for a more specific training once you are selected and you get your calendar. So it'll be a little more detailed then. But you can certainly feel free to give us a call, give Corby a call if you have any questions. She can answer a lot of questions. I can certainly answer any if you ever had anything come up.
So I'll be in touch in the next week to 2 weeks with the results from what you guys did today. So you had a lot of different tests done, so I'll let you know each step, what the next step is. So basically, we also did the genetic test today. That one takes a little bit longer than any of the others. And once that comes back and it looks a little more, you know, we'll let you know about that. And then the next step will just be to get you on the, get you to the psychologist, which I, yeah. But I'll let you know, and give you all that information. And if you hear from me, you know, or worry, just call me. It's fine. Or email me. So, thanks for your time today.
Yeah, thanks for coming. Look forward to seeing y'all soon.
Sure. Thanks.